So good morning. Thanks for joining us for our fifth in the series of our eConsult webinar series. This morning we have Dr. David Lee joining us. He's the former division chair here at Kingston for the Division of Hematology and is the director of the Anticoagulation Management Service here in Kingston as well. Dr. Lee has been answering eConsult, I think, since we actually started the pilot early, I guess late in the 2010s these days is what we call it. So we welcome your participation in this morning's event, Dr. Lee. So maybe we could have you share your presentation and we'll get underway.
Okay, just going to get into share here and
lovely.
Okay, well, thanks for joining in, everyone. First, we'll start with my disclosures. I have no financial disclosures or conflicts of interest to announce. And I think the learning objectives here are I think they're fairly self-evident, basically to see how to sort of demonstrate how eConsults work and how they are, basically how they can be advantageous to patients, referring physicians, and the specialists as well. And also, there's an opportunity here to kind of show perhaps what types of problems in hematology lend themselves better to the eConsult platform. So hematology is the second most requested eConsult specialty service in the province. And locally, we did 272 eConsults in our region in the last 12 months. That's really just a number, and unless you put it into some context. And so in my next slide here, I think it's useful just to review how the referral system works in hematology. And I think, knowing how to navigate this, it's helpful to know how to navigate the system. But the traditional referral, when it's faxed, it either comes to our office directly here in Etherington Hall, which is a building just in front of KGH, or some referrals are faxed to the Cancer Center. Either way, they are triaged centrally in Etherington Hall in our main office. They're triaged by the attending hematologist who happens to be on for consults that day. And those referrals are triaged in terms of a timeline to be seen. So they're prioritized, and they're also assigned to a location or clinic. And basically we see patients in either Hotel Dieu hospital or they're seen in the cancer program. And many of the referrals are assigned to the general hematology clinic at Hotel Dieu or the general malignant heme clinic in the cancer program, although we do have now an expanding list of specialty clinics. So at Hotel Dieu, we have thrombosis. We've had a long-standing clinic in bleeding disorders. We have an anticoagulation management service, and there's a new hemoglobinopathy clinic that started up just recently. And in the cancer program, we have a number of more subspecialized clinics: complex malignant hematology, stem cell transplant, and the aftercare clinic. So those 270 some odd eConsults that we've received in the last year, put into context, we receive over 2,000 referrals each year through the regular standard referral stream. And if we look at our Q1 data from this year, basically January to the end of March, we received 567 referrals, and that actually forecasts for something like, over 2,250 referrals for this year. So, at least a 12% increase in faxed referrals. And when you average that out, it basically means we need to be seeing 44 new patients a week to be able to keep up with the regular referral stream. And because most of these, or many of these referrals go into the general hematology referral stream, we actually don't have that many slots per week. And hence we have unfortunately quite a backlog of patients waiting not only to be seen, but even to be given an appointment to be seen. And so within that context, eConsults can be quite helpful. And I think it's self-evident how eConsults can be helpful. Because of the rapid access to a specialist, in contrast to a greater than 1 year wait time for non-urgent referrals that go into the general hematology stream, many of those non-urgent referrals can be effectively managed with eConsult. I will just add that many of the specialty clinics do not have that long of a wait time. So for example, we've very recently expanded our thrombosis capacity for in-person referrals. So the wait time for thrombo consults is less than 2 weeks and often less than 1 week, within a week. A hematology referral can actually be averted in 62% of cases when one had originally been contemplated by the referring physician, and so that helps us with our backlog, and that helps everyone. And in the event that a referral is still needed, it's actually still advantageous to have done a bit of pre-work ahead of time, because we can get some preliminary investigations done via eConsult, and that not only streamlines the consultation process, but it also allows for a more accurate or more effective triaging. So in all these ways, eConsults is good for patients, it's good for the referring physician, and it's good for our hematology division as well. So what are the reasons for hematology eConsultation? Well, 3/4 of the eConsults are for an abnormal CBC. And if we kind of break it down a little bit further, as you can see, anemia, high white blood cell count, low white blood cell count account for most of the eConsults for an abnormal CBC. We have a smattering of high platelets, low platelets, polycythemia, I think 1 or 2 pancytopenias. And outside of an abnormal CBC, we get referrals for an abnormal serum protein electrophoresis, high ferritin, and then a bit of thrombosis, lymphadenopathy, and questions about hemostasis, either hemostasis tests or queries about possible bleeding disorders. But again, most of the eConsults that we get are for an abnormal CBC. And these data are just from a self-audit that I did. I kind of looked through 100 consecutive eConsults that were sent to me between August and January. So what problems are best suited for eConsult? Well, in hematology, abnormal lab results seem to be well suited for the eConsult platform. This is especially if it's an incidental finding in a patient who is asymptomatic. So again, we get a lot of referrals for abnormal CBCs. So abnormal CBCs, high ferritin, questions about coagulation tests. These are generally well suited for eConsults. Serum protein electrophoresis abnormalities such as monoclonal proteins. We have a primary care pathway for mgus that has been around for a number of months now. And I will just take this opportunity to kindly request that if there is an eConsult that's requested of us, to please upload the lab or imaging reports that are the focus of the eConsult. That helps us a lot. Yeah, I've asterisked a couple of these bullets here, just to mention that some of these conditions may require specialized testing. So for example, referrals for a high platelet count might require molecular testing for myeloproliferative neoplasms. A high ferritin could be reactive, but it may require molecular testing for HFE mutation testing for hereditary hemochromatosis, or a high lymphocyte count may require flow cytometry. And all of these tests right now can actually be accessed by primary care. So the Ministry of Health did launch a community access pilot program for laboratory services just over a year ago, whereby primary care can access molecular testing in a tertiary care center through a community laboratory. So how it would work is if there's a need for myeloproliferative disorder molecular testing like JAK2 testing, that can be accessed here at KHSC by through a standard Life Labs requisition, and just attach to it the KHSC molecular genetics requisition. And what I try and do when I get an eConsult is I try and actually provide the specialized requisitions. So for any of you that have requested an eConsult from me and it's about lymphocytosis, for example, in my response, I will include the flow cytometry requisition for Life Labs, for example, along with instructions of what check boxes to tick off, et cetera. So and this community access pilot program, it actually was set to expire at the end of March of this year, but it's been extended for another year. So hopefully this will be a keeper, because it actually it's actually very useful, especially in hematology, because otherwise we end up asking that the patient be referred to us formally simply to do the test. And there's really no reason, in my opinion, why primary care can't access these tests. So I'd mentioned the primary care management pathway for mgus, and this is Doctors Monteith and Dr. Hay from our division did an outstanding job in constructing this primary care management pathway for mgus. And in this document, There's a quick mgus backgrounder along with appendices if you want a bit more information. How to monitor mgus, what to watch for, when to refer the patient to us, how to contact us, as well as also a patient information page as well. So if we get an eConsult for an mgus case, unless there are red flag features already, then we will typically respond with the mgus pathway, and it's pretty inclusive. The flow diagram may at first glance look a bit daunting, but it's actually easier to navigate than what the picture might appear. And just as a reminder of how to contact us, well, here's our contact coordinates. Our main office, again, is in Etherington Hall, which is a Queens building that's on Stewart Street. I just want to emphasize that you can always speak with a hematologist. During the daytime, the hematologists on consults can always be reached. You might get the hematology fellow if the fellow is also on consults. The fellow is either a PGY4 or PGY5 hematologist, trainee in hematology. Evenings and weekends, ask for the on-call hematologist. And we certainly field calls from primary care as well as other specialists at any time of day, weekends, or on call at night. So please don't hesitate to contact us if there's an urgent question or query. So with that, I think I will perhaps open it up to questions or comments.
Super. So maybe we'll just stop sharing your presentation.
Yeah.
So we can open it up the screen to the participants. So great opportunity to ask Dr. Lee some questions. Maybe I'll get started with the first one. So you mentioned this pilot for community access. So how does that work in an eConsult setting where someone might send you an eConsult for an abnormal CBC, for example, and then that results in you suggesting further testing? Can you continue that exchange through eConsult?
Yes. So sorry, I just need to stop sharing my screen here for a second.
Yeah.
Hang on. Where's my somehow, where's my stop sharing screen thing? Anyways, I'll just keep talking here. So the eConsult sort of dialogue, so to speak, the back and forth, I think eventually is closed by the individual requesting the eConsult when they, I guess, close the file. And that,
right.
I suppose that could just be left open. And that's been done before. So for example, just recently, I responded in an eConsult. There was a query about a high lymphocyte count, and I suggested doing flow cytometry. I sent as an attachment in my eConsult the flow cytometry requisition, which that test doesn't actually need to be done here at KHSC. Life Labs, for example, actually has a very good flow cytometry service. But anyways, I sent the Life Labs flow cytometry requisition to the referring physician, and said something like, well, you know, flow cytometry report will take, you know, a little while to come back. They're not necessarily written with primary care physicians in mind, so they can be a little bit confusing to interpret. I'll just stand by if you want to get back to me, if you then want to send the report back to me, and I can help with the interpretation. And so we can kind of leave that channel open. I don't know if there's any messaging that comes up from eConsultation to kind of remind people that they still have eConsults that are not closed. But anyways, that I've kind of just left things open, and in anticipation of getting the report back, and then we can kind of go through it together. The molecular reports will take longer, and so it can take about a month for the molecular reports to come back. And in that case, basically how it would work is the primary care provider would append a KHSC molecular requisition to a Ministry of Health requisition, which is basically the standard rec that you use to get blood work done at Life Labs, for example. And on that requisition, it would say, I don't know, MPN panel, please see attached. And what is attached is the KHSC requisition, and again, along with instructions on how to, I would provide instructions on how to fill in that requisition and which tick box to check off. Yeah.
Well, and I think to your point, we could always close the first eConsult when you've suggested further testing. When the tests come in, they can send a second eConsults with the original information and the supplementary report they've now received, right?
Yes, correct. Yeah.
And also, I guess it would help for in-person visiting. So you might have received an eConsult, but deemed that you need to see that patient in your clinic, in which case there could be testing that happens in advance of that visit in your office where the patient's appropriately prepped.
Right, correct, yeah.
Great. Other questions on the call for Dr. Lee? So interesting that 62% of referrals can be avoided through eConsult within this specialty.
Yeah, it is interesting. I was looking back, so those figures are from July to December of 2021, and I was looking back through some older data, and previously it was kind of hovering around 50%. So of those eConsult queries where a referral was contemplated, it seems that an even greater proportion now are felt to no longer be required. So, yeah.
And now new services coming on board. I know we have created our own category within hematology for thrombosis, with Kirsten DeWitt, Dr. DeWitt, now taking on those eConsult questions. So happy to see that service extended.
Yeah, actually, the thrombosis service has really expanded. We've gone from quite honestly embarrassingly long wait times in thrombosis to a top-notch service with Dr. DeWitt and Kat Kenny, who's our nurse practitioner, who now has several clinics in thrombosis as well. So our capacity in thrombosis for in-person consultation has greatly expanded.
So I know you've been doing eConsults for a few years now. Have you seen a change in terms of what's coming through eConsult?
Not really, other than perhaps the overall volume increasing. I think I do see perhaps fewer complex questions. Of course, the eConsult platform doesn't handle complicated situations very well, because there's no way for the person providing the eConsult to feel confident that they have a good situational awareness, the more complicated the patient is. And there's no way to, the more complicated the patient is, I think the greater the need to probably have a direct connection and dialogue with the patient. And that's obviously something that eConsult lacks. And so, the nuances become more important the more complicated the patient is. And that I think that's a situation where no matter the specialty, it doesn't lend itself quite as well to the eConsult platform.
And just, I guess, a question talking about what's happening within the eConsult space. So with eReferrals, I know many of our primary care providers are now moving to Ocean eReferral as a way of sending eReferrals, stepping away from the fax referral to the eReferral. Does the division have plans in moving to that direction soon?
Well, we're cautious about moving forward right now, because we have a system in place using old-fashioned, faxes, paper faxes, that works for us. And the bottleneck, there is no bottleneck in terms of distributing the new referrals that come to us. That's not what is taking a long time for patients to be seen. It's not a matter of maldistribution or lack of optimal distribution of these referrals across available physicians to kind of equalize the wait times. That's not the issue. Whether we get referrals by paper fax or electronic fax doesn't solve the problem where the problem of overall capacity.
Just the volume.
Yeah.
So as you say, eConsults is a great way to get easy access to hematology services. And I guess the other thing to be learned here is that you can always send an eConsult if the patient still needs to be seen. It's a good way of confirming that that's the correct course of action.
Absolutely.
Excellent. Final thoughts for this morning's discussion? Well, it sounds like it's a very effective tool for hematology. As you say, the second most popular eConsult service that we have on offer. So thank you very much for joining us this morning, Dr. Lee, and everybody else that joined us on the call this morning. We really appreciate your time as we work to spread the message about the advantages of eConsult in our province. So next up, we will be having Michael Leverage from Urology come and talk to us on April the 29th. So we look forward to seeing you all back then. Have a good day, everybody. Please stay safe. Take care.
Bye, everyone. Thanks.